Hello friends, this is Priyanka. Another review session for the fundamental of nursing from Simple Nursing. I'm very keen to help the internationally educated nurses. So if you want this video in Hindi or Punjabi, please let me know and I'm happy to do so. So in this review, I'm going to touch the very important topic that can appear in the Nclex and other exams. And I can also do, I'm also willing to do a question and answer series after this review session. So please stay tuned and please subscribe if you like. And so first thing I'm gonna be talking here is IV tubings. So they're not never the Nclex will never gonna ask you a question like, okay, when to change IV tubing. It's very rare, but they will give you a scenario how often you have to change the tubing that has a medication running. So for that we have to change it every 24 hours. If that's a tubing that doesn't have a medication running, so that's gonna be 96 hours, usually between 72 to 96 hours. So those kind of things we need to know. Another thing we need to know here that IV tubing sites and infections. For example, they can ask you a question regarding the patient has a redness and swelling and warmth, around the IV insertion site. What will you do? So the management part is change IV site immediately. Stop the IV infusion and let the doctor know. So usually the rule of thumb, as we all know, is change the IV site 72 to 96 hours. Very, very important thing to look for is warm. Okay, if the site where the IV is inserted is warm and it has edema, so that means it has phlebitis. That means the vein where we put the IV has inflamed, so that we need to take care of that. If that site is cool but edematous, so that means that's infiltration. So for that part, so what we have to do, usually we stop the IV infusion and we let the doctor know that the IV is running. Nclex is all about what you gonna do before you call the doctor. Okay, so you have to critical think. So if the surrounding area of IV site is cool, that means it's infiltration. If it's warm, that means it's phlebitis. Okay, so that's what it is. Another thing I'm gonna teach you here is incident report. Okay, so in the Nclex they give you a scenario. For example, the patient forgot to take their medication. Is it an incident report? No, it's not. Any significant occurring, for example, the patient fell, he didn't receive care in a timely manner, he didn't receive the lab result, he didn't get the x-ray done, he had a drug reaction. So all these significant occurrings are incident report. We cannot document something like nurse was late for a shift, right? So we cannot report something like that. So keep in mind. So another thing I'm going to be telling you here is PICC line. PICC line in Canada, US, it's all about PICC lines these days. There are certain medication where if we use with IVs these days, there's so many complications. So they have started the PICC line. Okay. So for the dressing, as you know, every IV or every site has dressing. So if it's a gauze dressing, the old school dressing with those gauze pieces, we have to change that dressing every 48 hours. And for the transparent dressing, is the advanced dressing. There's less infection, they stay on for longer, so you change them usually after 7 days. Okay, so you have to remember the PICC line that way. So next is PICC line. How do you flush it? So you flush it before you give anything and after you give anything. For example, you're giving medication via PICC line, so you're gonna be flushing it before use and after use. Okay, so you're gonna be telling the patient don't lift anything heavy from that PICC line side. Let's say you have a PICC line on your left side, you're never gonna be sleeping on your left side, never gonna be lifting on your left side, no holding purse on your left side. Okay, so remember that, and only use normal saline, nothing else to flush. Okay, that's very, very, very important, so keep that in your mind. Okay, so enteric coated medication, so we don't crush them, we never chew them. Okay, so don't cut them in pieces, never mix them in food. Okay, because they are meant to absorb in the intestine. Okay. okay? So we never want to already absorb them into the stomach. So these are enteric coated. One more thing I'm going to tell you, never give enteric coated medication in the NG2. These are the things no one will tell you, but very important. The Nclex will try to trick you on these questions, okay? So keep that in your mind. Okay, so let's jump on to the next topic. So that is inhalation medication. So that means nasal sprays, okay, or the nebulizers, okay? So how are we going to use them? So first of all, we have to shake them, okay? And then if you're a nurse, you're going to double check the prescription, of course, 5 rights. And so place patient, like let's see, in a comfortable sitting position, okay? So shake the meter dose inhaler and insert the MDI. Sometimes there's spacers as well. We attach them with the meter dose inhaler, and then we place them in the mouth, okay? Sometimes we hold the breath for 2 seconds and then we exhale. So that's how we use it, okay? So very, very, very important topic. I'm pretty sure that you will have at least one question of these, like how to position patient. They might give you a pictures, or they might just simply ask you, okay? So thoracentesis, sitting position, okay? So thoracentesis, remember Santa is always sitting, okay? Paracentesis, so sitting as well, remember Santa in your mind, okay? Lumbar puncture, so where is the lumbar part? It's in our back. So of course you cannot be sitting, so they have to see your back. So you have to act like a baby for that. So lumbar puncture, you have to have a fetal position, okay? Liver biopsy, supine position, okay? Remember that. Okay, so lama means leave against medical advice, okay? So when you cannot do that, so when you are in danger for yourself and other, that means you are hitting others, you're trying to kill others, when you're suicidal, okay? When you are not alert, you're unconscious, the doctor just can't let you go, right? And when you are a criminal, right? So those kind of things, they won't let you go. But usually if you want to leave against medical advice, if you don't want to seek the medical treatment and attention, you have the right to let you to go and leave the facility. But what they will do, they'll make you sign a consent form, okay? So eardrops, how are you going to remember? I usually had a hard time remembering this. So what I remembered, so adult is up, okay, and infant is high in this picture. So that's how I'm gonna remember it. For the adult, I'm gonna pull the pinna up, and for the little one, I'm gonna pull the pinna down. I think for those who struggle with this will really appreciate this trick of mine. So remember that in your mind, please. So adult up and the little one is down, as I've seen in the picture. So that's how we pull the pinna, okay? So let's jump on to our next topic. So NG2 placement. So how are you going to check if it's in the right place? Always use the chest x-ray, okay? If there are tons of options, if there's a chest x-ray, you always going to pick the chest x-ray, because that's the best treatment, okay? We don't really use the pH, we don't really use the aspiration, we don't really use the bubble method anymore, where we put the tube in the water and we see the bubbles. So no, that's old school, okay? The usual stomach pH is less than 5. If you get a question like that, okay, what's the stomach pH? So that's less than 5, but use the x-ray first, okay? Okay, now let's come to the blood transfusion. So for the blood transfusion part, there's 3 types. There's RBC usually there's platelet and fresh frozen plasma. Okay, for the RBC, we want to infuse them for RBC around 4 hours maximum. Okay, if you have to infuse something else, another unit, you have to wait. You cannot really infuse them continuously. Okay, remember, one bag increase the blood flow, the blood volume to 1 liter only. Okay, if your HP was 13 before, it's gonna be 14. It's not gonna jump. Okay, another thing we have to keep in mind is fresh frozen plasma. It's every 30 minutes, okay? And platelet, as you finish your plate in 30 minutes for half an hour break, right? So that means you have to infuse it within 15 to 30 minutes, okay? So remember that trick. And blood transfusion, very, very important. You have to have a informed consent, and then you have to do the cross matching, not with yourself. You have to have at least 2 staff to do the cross matching, okay? So keep that in your mind, please, and follow these steps. Okay, so 24 hours sputum collection. So always remember, so whenever you have to start the very first morning, let's see 8 a.m. today, early morning, and you have to finish it tomorrow 8 a.m. So that's why it's called 24 hours. You have to put your sample on the ice, okay? Because we want to keep it cool, and you have to keep it in a dark container. So after we get the sputum collection, we have to send it to the lab immediately. And remember, no midstream urine collection sample is required. Okay, so these were some important tips that I shared with you. I hope you liked my video. If you want it in a different language like Punjabi, Hindi, please let me know. So if you know everything about fundamental but you don't know these simple tricks, I took a time, I read my notes, UWorld, Archer, so many different sites, YouTube's, Google, and that's how I collected these. So this is a lot of investment of time. So you need to know this before you write your exam. So please consider subscribing to my channel. It's gonna encourage me more. I'm always with the thank you so much for watching, and stay tuned for more videos and give suggestion if any. Thank you so much. Have a wonderful day.